In this video, we will show you how to make your own eye patches out of 3M medical tape and review how to properly place and remove under eye patches and paper tape. We will also go over some tips and tricks for lashing inner corners and clients with fluttering eyes.
We recommend making your own eye patches with 3M 5cm by 5cm tape. You can purchase this from Amazon. Prepare some parchment paper, as we will use it as the base of the eye patches. Number 1. Grab your scissors, parchment paper, and 3M tape. Number 2. Tape the 3M tape onto the parchment paper. Number 3. Cut this shape with a pair of scissors. Cut on a slight curve similar to a lower lash line. Don't worry if the shape isn't perfect, 3M tape is stretchy. Number 4. Store the ready-to-go eye patches in a container by your station. Keep the rest in a Ziploc bag for future use. Have the client open their eyes and look up. Press down the lower lashes with the eye patch and start from the inner corner. Place the eye patch on the lower lashes and try to cover as many lower lashes as possible.
If the upper lashes are too straight and are in the way of taping the lower lashes, simply use your finger to hold up the upper lashes. You can use your fingers as tools as well, as long as your hands are clean and sanitized.
Don't worry if not all of the lower lashes are covered. We will use paper tape to fix the rest. Paper tapes are usually very sticky. The skin surrounding our eye area is the most delicate skin on our bodies. If you want to use paper tape directly on the skin, you need to reduce the stickiness of the paper tape on your tweezer before taping the eye area. By doing this, the tape will not be too sticky to remove from the under eye skin after a few hours of lash application. Cut the paper tape into small pieces. Tape the lower lashes that the under eye patch did not cover. Be conscious that paper tape is very sharp and you should not apply it too close to the lash line. Always ask the client if the tape feels comfortable before applying any extensions. Adjust the eye patch and tape if needed. The inner corners are the hardest areas to apply lash extensions. The natural lashes here are very close to the skin and to the bridge of the nose. There are a few tricks that can help you with these lashes. You can place the paper tape outwards so the roots of the inner lashes show. Press your isolation tweezer down on the 3M eye patch. You won't hurt the client because 3M is thick and stretchy. When applying lashes, always work on the hardest part first. Lash the inner corner first, then the rest of the set will be easier to apply. When a client's eyes are fluttering, it is usually because the client is nervous and having trouble relaxing, or they're talking too much. You will have trouble working on the lashes if the client's eyes are fluttering. You can make the client feel more comfortable with a cozy blanket, a warm tea, play some relaxing music, or use some essential oil to help them relax. If the fluttering continues, use something slightly heavier like a 3M eye patch on the upper lid. When a client is unable to fully close their eyes, you can either tape down the eyes to force the eyes to close, or provide disposable contact lenses to wear during the service, which are removed right after the service. The purpose is to block the eyeballs from getting exposed to fumes and the adhesive and avoid irritation. Peel the paper tape on the eyelids slowly in a downwards motion. Again, using one hand to hold the skin and the other hand to peel it off. Be very careful on the brow area as you do not want to peel off the client's brows. When you apply the tape to the brows, leave a little gap. The under eye patch can stay on the eye area for up to 2 hours. Sometimes it can be very sticky and painful when you peel it off the skin. Peel off the eye patch slowly, starting from the inner corner. One hand should hold the skin, while the other hand pulls the eye patch gently.